China now. It has denounced the decision to impose restrictions on Chinese travellers because of the rising COVID infections and warned it might take reciprocal action. International health officials have criticised Beijing for failing to release data on the spread of the virus and possible new variants. The US and about a dozen other countries will require those arriving from China to produce negative test certificates. Many Chinese have been rushing to book their first overseas trips in years after Beijing lifted its own travel restrictions. Well, Chinese Foreign Ministry spokesperson condemned the requirements on travellers.
We are
willing to strengthen communication with the international community and work hard together to overcome the epidemic. At the same time, we also believe that some countries have imposed entry restrictions targeting only Chinese travellers. This lacks scientific basis and some practices are unacceptable. We firmly oppose any attempts to manipulate epidemic prevention measures in order to achieve political goals. We will take countermeasures based on the principle of reciprocity.
Meanwhile, in the United States, concerns are increasing about a new highly contagious Omicron variant named XBB.1.5. The Centre for Disease Control and Prevention showed over 40% of COVID-19 cases were caused by the new strain. Epidemiologist Dr. Eric Feigl-Ding is on the COVID-19 Mortality Expert Committee for the World Health Organization, and he told me there is cause for concern with the new subvariant.
XBB.1.5 is the next big one. I think people have underappreciated. CDC, just disclosed it was 40%, but they had completely not disclosed that it's been surging for the prior 4 weeks. And XBB.1.5 is more evasive. It's the most evasive variant known to date. And unlike basic XBB, it is much better at infecting cells. Based on what we know. So it's, in many ways, it's the worst of both worlds. And if you look at the stats, wherever it's dominant, like in Northeast New England area of the US, it has, hospitalizations have surged. And it's also surging worldwide in other countries and been found in other countries, including in the UK, where it's growing rapidly as well. So this is the next big one. And I think without good genome surveillance, we would not have been aware that this is the new culprit. But this is, I think, the variant to keep an eye on.
Okay, do we have any idea, crucially, on how effective the vaccinations that we currently have are against this? For example, the hospitalization numbers, do we know how many of those are vaccinated or not?
Yeah, so this is the problem. First of all, to know the real-world efficacy, it takes time and enough numbers. And the other thing is, XBB.1.5 is not a regular Omicron. It is it's a recombinant crossbreed of two different lineages. And so, and these are lineages of BA2. And so, for example, the UK bivalent is a BA1 bivalent, while the US bivalent is a BA5 bivalent. So neither of them are actually going to be perfect. We're hopeful that it will work against hospitalization, but against in terms of infection, and again, infection leads to long COVID, we're very worried. And there's evidence that because it is so good at infecting with the human ACE2 receptors, that it could actually lead to worse long COVID because even low levels can cause huge amounts of problems.